Hello, my name's Dr. Tim Alexander. You have to bear with me a little bit because I talk a bit funny because I come from New Zealand originally. Even though I've been here for 40 years, I still talk a bit down underish. But anyway, I came to Florida to go to the University of Miami Plastic Surgery for postgraduate training because I did most of my training in England and in Australia and New Zealand. And I've been in practice for 40 years and with the Florida Center for Cosmetic Surgery for the last 20. And I'm the senior surgeon here with the most experience, 40 years. While I was at the University of Miami, I worked with, I trained under Dr. Ralph Millard, this very well-known and most well-known plastic surgeon in the world at the time, and also Dr. Thomas Baker and Howard Gordon, who are also excellent cosmetic surgery. So I had a very good introduction to plastic surgery here in Florida. Brazilian butt lift has been in practice in America for about 15 to 20 years, and we do lots of them at the South Florida Center for Cosmetic Surgery, and we haven't had any adverse incidences yet, touch wood. The operation takes about an hour and a half to do. It's done under general anesthesia, and we did under general anesthesia, so there's less discomfort for the patient. And you can't sit down on your backside for a week afterwards, and you have to wear special compression garments which we supply, and we'll give you directions as to how to find them. It takes about a month for all the swelling to go down. It's a great operation because it contours the whole body. It not just accentuates the backside, but it makes the waist smaller, gets rid of some fat on the back and the tummy. And if your skin's too loose on the tummy, like having a lot of children or even one child, sometimes you're going to need a tummy tuck as well. The only person that's not a candidate for a BBL really is somebody who's too thin, hasn't got any fat, or hasn't got enough fat to transfer. And sometimes even putting on 10 pounds on a really skinny person, that's enough to do the job. It really is. It's quite remarkable, really. I must say that when the first operation started 20 years ago, I was a bit skeptical about it. We did a few sort of semi-experimental cases here, and I was very pleased with the outcome. Some people have unrealistic expectations and expect to bring in pictures of huge balloon butts and things like that, but if they haven't got the fat, that's not going to be possible. So you have to have realistic expectations. A high BMI with a BMI over 35, it really is not possible to get a BBL because the hospitals won't allow plastic surgeons to do them there, and that's where the high BMI cases have to be done. But they won't allow you to do BBLs at the hospital, period. So you've got to lose some weight, get a tummy tuck, breast reduction, something before you can get a BBL done with a high BMI. Well, breast augmentations come and go in popularity over the years. How many I've done? Probably about 30,000 or more. We use two kinds of implants, saline and silicone, and there's various types of projection, high profile, medium, and it depends on the individual what they want, and you have a conversation with the individual to see what their expectations are. For example, the next case I'm going to be doing was big, so it's a 700cc implant, it's a saline implant, which I'll be overfilling probably up to as much as 900 cc's. But they go right down to probably the smallest implant would be about 150 cc's, which isn't very big at all. Okay, we're talking about transgender surgery. Well, we're doing a lot of that now. We're getting sort of renowned for it, really. It starts off as doing like male to female breast implants, top surgery, and then to a lesser extent female to male top surgery we do is subcutaneous mastectomy. And then there's a lot of facial feminization done too, and also the Brazilian butt lift, which we were just talking about, that's quite popular in transgenders too. In the facial feminization, we do in things from chin implant, buccal fat pad removal, which makes the lower part of your face look thinner, cheek and augmentation, rhinoplasties, changing the length of the forehead, blepharoplasties. It's amazing how this number of small little things can make a big difference and soften and give a more feminine look to the face. Rhinoplasty is a great operation. It takes about half an hour to 45 minutes to do. That's done under general anaesthetic, and surprisingly it's not very painful. For the day after until the day after the surgery, you got some packing, some gauze in your nostrils, and that comes out after 1 day, and you've got a plaster split over your bridge of your nose, which stays on for a week. The type of manoeuvres done in the rhinoplasty has to be determined by looking at the patient and discussing with the patient what they want changed. There's about 20 different things you can do to make a difference in the nose. Well, breast reduction is very common in women. In fact, I've just finished doing one. Really, in a breast reduction is a breast lift and reduction, because usually with a person with big breasts, their nipples have deteriorated and fallen down a long way. So you lift them up to the correct level, which is about 7.5 inches or 8 inches away from the midclavicular line. Basically, you resect a lot of tissue, and it's like you end up with a scar that looks like an anchor around the areola, a vertical one and a horizontal one. In men, there's 2 or 3 types of male breast reductions. Mostly it's called gynecomastia, and sometimes, most frequently actually, it can be done by just making a small incision around the areola. Other ones, when they've got breastosis, in other words droopy breasts, like in a female case, a more extensive operation has to be done with a transverse incision and another little incision around the areola. Well, mummy makeover is a lay term. People interpret it how they like, but for me it means usually some breast surgery, which is either a breast augmentation in the lift, or breast reduction, liposuction, and a tummy tuck. Bundling those groups together, which is a very common package, and we do them all the time. Well, the BMI requirements is 35 to be done in the outpatient centre, but you can still do these surgeries in the hospital or the other outpatient centre, which has got a higher specification than the Florida Centre. It's important because the fluid balances and post-op recovery are quite different, and the facility or ability to have the patient stay overnight in the hospital is important, rather than being an ambulatory walking home type patient. But most people tend to get down to the BMI, and probably about 10% of the cases we do in the hospital. If you'd like to have a consultation, and these days of the coronavirus, we're doing them essentially virtually. So you take some selfies and send them to our specialist girls and explain what you want, or what you'd be desirous of, and they show me the pictures, and I discuss with them what would be the best procedure for them, and then they'll give you an answer and go from there. And if you really do want to have surgery and you're booked in and you want to talk about the case more in detail, you can do that with me anytime.